Frontline workers in Papua New Guinea have received their first COVID jab alongside the Prime Minister. Australia has sent 8,000 doses of the AstraZeneca coronavirus vaccine to PNG after it recorded a surge in cases. PNG has reported more than 5,600 cases. These numbers are underestimated, though, due to a lack of mass testing. Health authorities say PNG is facing an incredibly challenging situation, with resources stretched thin and misinformation about vaccines spreading.
There is a lot of stigma associated with COVID-19 infection in PNG. Our colleagues who are working on the front line in healthcare there are feeling it. They tell us that there is a degree of stigma, and that's also impacting on the willingness of individuals to receive vaccination. There is quite a lot of misinformation out there, unfortunately, predominantly spread through social media.
Let's bring in the Minister for International Development and the Pacific, Seselja. It looks like it's a country on the precipice at the moment, with the health system being overwhelmed, the economy also struggling. From the latest information that I've received, the reports of 7 carjackings a day in Port Moresby, looting. Is it a country on the verge of collapse?
No, Kieran, I wouldn't say that. There are certainly some serious strains on the health system, but I wouldn't accept the characterisation that the health system is overwhelmed. So we do have an AUSMAT team on the ground, which has been giving obviously a lot of rapid information back to the Australian government about what more support is needed over and above the significant support we've been providing. And, you know, you talk about the 8,000 doses that have been delivered, but before that, over these many months in the lead up, we've been giving significant health support, whether it's PPE, whether it's ramping up health facilities and health capacity. So the system is definitely under strain, and what we are going to do is work with the PNG authorities to look at what additional support we can provide, whether it's obviously more vaccine doses, more technical assistance, other types of support to ensure that as this challenging situation unfolds, that the PNG government and the PNG people are able to deal with it.
Up to, well, or close to 6,000 cases, 60 dead. That's an underestimate, though, isn't it?
Well, it likely is. Obviously, testing has been strained, and we've provided a lot of support in that space, but I think it's fair to say that they would be underestimates. I think that's true anywhere you look in the world. When we look at when there are case numbers increasing, you don't always get them all, but there's no doubt that on the figures that we have, those figures have been tracking up, and that's obviously a significant concern. That's why we rapidly deployed those 8,000 doses of the vaccine. That's why we're considering what further assistance we can give. We've committed $144 million to PNG for vaccines, and so obviously the question as we work with PNG authorities and as we consider our own situation, the question will be how those doses are delivered. Obviously there's multilateral facilities like COVAX, which we're contributing to. We'll work with UNICEF and other partners for procurement. We're obviously looking at what capacity there is, what further capacity there is out of our own domestic supplies. So whilst our first priority, of course, is Australia, PNG as a close friend and close neighbour is always on our minds, and we are working with them to deliver as much support as we possibly can.
You might turn to that locally manufactured and AstraZeneca supply to send to PNG?
Well, that's certainly something we'll consider. So we obviously want to make sure that the people of PNG get sufficient number of doses so they can deal with this outbreak. So they are due to receive a significant number of doses from the COVAX facility, and that's a multilateral facility that we've contributed significant amounts of money to. So those are due. We've obviously put in the request for our 1 million doses that we contracted with AstraZeneca to come out of Europe, and we've asked the European Union to release those so they can go to PNG.
Any hope of that?
Well, we're certainly continuing to push our European partners on that. We think there is a very strong moral case. There's obviously a case in terms of the contract we've signed and the fact that we have paid for these doses. But what we have said to the Europeans is, OK, if you're not going to provide them to Australia, well, PNG, as a developing nation, as a nation that is in great need and is suffering this outbreak, we would love to see it go there. So we'll continue to push for that, but we'll obviously look at other options in ways we can support.
When COVID emerged, it was revealed that there were only 7 ventilators across PNG. They had 7. Has it taken the government too long to recognise that this was a looming disaster to our north?
Well, look, I think people can obviously do their postmortems on government responses in PNG, but what I would say for our friends and neighbours in PNG...
I'm saying in terms of our government, knowing that there was a possible crisis up there.
Well, in terms of our response, it didn't start with the 8,000 doses of vaccines that we've delivered. I pointed out the $60 million of specific health support that has been delivered prior to that time. So we've been providing PPE, we're providing masks and goggles, we've been providing technical assistance, we've been helping them ramp up their health facilities. So at every step we've looked to support PNG in preparing, in dealing with this outbreak, and obviously now we're seeing, more cases coming to the fore. So we're obviously looking at how we ramp up our response, but it's not starting from a low base, it's starting from a significant amount of support with the promise of much more support to come.
I saw you made an announcement this week in WA. This was a new vessel for the PNG military. What's that all about? Is it about their own security? Is it about piracy? What's the
these
issue?
Guardian class patrol boats, this is the second of the Guardian class patrol boats that we've provided to PNG, and this is part of a program right throughout the Pacific. And we're looking at 21 of these vessels in places like PNG, like the Solomons, Fiji, right through the Pacific. And what it's about is about their sovereignty. And obviously, when you look at the Pacific, there is a lot of ocean to cover, and obviously significant resources and significant interests for those nations to make sure that, particularly things like their economic interests, fishing in those regions. So yes, piracy, illegal fishing, those sort of things. This was a really significant day, and it was really pleasing to be there with the crew to see this new vessel that Australia has gifted to PNG, and I know it was very well received.
So in terms of when you say the sovereignty, it's obviously a start because they don't have an enormous military, so they're starting from a very small foundation, aren't they? Not just PNG, but all the nations, our Pacific neighbours.
Yeah, look, absolutely. But, we work with them for the security and stability of our region, and this patrol boat program is an important part of that. It does give them significant capacity uplift to what they have at the moment. This is the second of 4 that are going to PNG, and as I say, part of 21 boats. Now, there's great news for Australia. There's 400 direct and indirect jobs there in WA. There's jobs in maintenance in Cairns. But for the people of PNG and other nations in the Pacific, this really does help them support their own economic interests and their own sovereignty.
We started the discussion about the vaccine cooperation with PNG. It looks like just finally there's a fraying of the cooperation between the federal and the state government. Do you recognise that a spat or a bun fight between the state and feds over the pace of the vaccine rollout doesn't really reflect well on anyone?
Well, look, it's certainly not the game that we're going to be in. The game we're going to be in is to deliver for the Australian people when it comes to these vaccines. So we need to do that in partnership, of course, with the states and territories. That ramp up, it is ramping up in terms of those numbers. There are always some challenges, I think, early in these rollouts, and I think what you'll see in the coming weeks is significant numbers of extra doses going right around Australia, and I think we'll probably look back at this period in very different light as those doses are put in people's arms over the coming weeks and months.
Seselja, thank you very much, and all the best to you and your large family for Easter.
Thank you, and same to you, Kieran. Happy Easter to you and to all your viewers.